first of all, can I ask Amir to come and say a few words and conclude this session for us?
Thank you very much, Dr. Qazi Zama and all the audience and the speakers. I must admit that this was a great session, and still it's good to have a few faces here. I think and they're the individuals who are really keen and dedicated. So thank you very much for all of you to hang around. Those people who have left, I think there were some logistical issues. I know it's heartbreaking for the presenters, but of course, if they're traveling, they have to go. Now, just going through this session, which I found very enjoyable, and I think I learned a lot. First of all, Professor Patel, I must congratulate you on an excellent presentation on a hot subject, which is very important for all of us. And as you mentioned, in a very brief time, I think you educated us very well. So that is a hallmark of an expert who makes a very complex subject look easy and make his, I must say, illiterate and ignorant audience like myself very competent towards the end of that. So thank you for sharing your experience with us. Just one comment that, as I discussed before, metabolic syndrome surgery has come in, and I think it's really helping those individuals. And this is something where the physicians and the surgeons need to collaborate, and that'll be helpful. Now, Mr. Asghar Ali Wai, I have met him socially as well. Every time I meet him socially, I think that Agora is invited to Desi party. Today, when I saw him, I was trying to connect him in the Royal College of Surgeons. I think it's after my jet lag. I apologize, but excellent presentation. And I agree with you, Kent is the garden of England. I live there myself, and you do need a bit of gardening after a very busy schedule, and you work in an excellent hospital, which is very busy as well. I think the information that you shared with us about the test and various other things, I know that the A&E is the gate to the hospital, and it's a continuous challenge, and it's like a roller coaster once you're there. And you can deal, within a day, you can deal with all sorts of emergencies across all specialities. And I'm really impressed with the knowledge that consultants like yourself have. But it does need a huge backup and support from all the other specialities to pick up the patients early. But the information that you shared was excellent, and thank you very much. And I think there could be a collaboration with other hospitals like Lady Reading, as they were mentioning earlier, to have some of these protocols and other methods there in those hospitals as well, which will be helpful. Thank you very much for your excellent presentation. I think next is a person who was a breath of fresh air. I was sitting right behind her, and I thought, who is this young girl? Because she still has the freshness which people tend to lose once they come into the environment of the hospital. But I was really impressed with her and George's presentation, because it's excellent what you're doing. This is our future. Whenever I'm in London with my daughters, and if we are on the tube station, I like to look at the board. They just pick out their phone. And I get upset, why do you pick out your phone? And before I can check on the board from where we are going to get the next tube to the place, they give me the answer. And I agree with you that these apps, these are the future, connecting everyone. And I think a suggestion coming from the guru, Dr. Suhail himself, he has pointed it very well, and I think probably identified a huge potential for you to have some apps or webs for the local hospitals, which they can control within the hospital, and they can share the information within the hospital freely, and that'll be fantastic. So I think, George, once you make that app, pay him 5%. Okay. Fine, it's very important, but thank you very much. I think it's great. Now, may I ask, what will you specialize in, or? Okay, I thought you were going to say apps and those things as well. It's application.
I think this is kind of a side thing. So I want to be an academic clinician and be involved in research and disseminating knowledge, and this will be something I'll do alongside it. But obviously, my first and foremost priority is to become a good clinician, so hopefully I'll be able to do that.
So, excellent. And we have another Dr. Suhail in making, very good orthopedic surgeon, where at the same time doing something different as well. And I think that's excellent. Well done. Now, coming to excellent lecture by Dr. Qureshi, I think the talk was excellent, and all these apps, these are extremely helpful. It's just like carrying a library with you. And it's very impressive because in old days, when we used to get into trouble, we used to run to the library or try to identify a few of the books. But if you see in the theater rooms and other places, all these libraries are getting outdated. We can't have up-to-date information. He was talking about updating the information every month. Sometimes we pick up a book which was written 30 years back. So I think that is excellent information, having the BNF guidelines and all those. And I really appreciate your talk, and I think you will keep us updated about this as well. Thank you very much. And I apologize to everyone for missing the morning session, because that was a session that I wanted to be here and talk about some of the work that Dr. Suhail is doing. Before I just go on to this, I think I'd like to thank all the staff and Ms. Eagle and Joel as well, and the team. It's a very strong team, and I think all of you have worked very well, and we must appreciate your effort into this meeting. My boss with whom I worked, Professor Bailey, in mid to late 90s, he was the first one to do teleconferencing in this country. And we did teleconferencing. We managed to do the virtual clinics. And this was the part of a thesis of one of our doctors, young doctors, who was a fellow who became a consultant afterwards. However, 6 months later, we saw the Times cover. And there was a photograph of one of the guys who was working with us, but he just went there to Bosnia. And over there, he saw a patient because he had the idea, and the patient had significant injuries. He did telecommunication and sent the images to Liverpool, and they arranged the surgery. So this became a big news for Times cover. Interestingly, he never mentioned our institution or hospital where he'd observed it. At the same time, I think as I'm involved with teaching and training in laparoscopic surgery across Europe and other countries, we do lots of teleconferencing, and I'm very well aware of various methodologies that can be used and how we do the lectures and talks and videos. Now, first time when Dr. Suhail talked to me about presentation and things like, I thought, fine, I can teach him a few things. I have a background of about 15, 20 years of doing it. But as I sat down with him and he showed me his first program, I thought there was a lot for me to learn. And very quickly, I think, not only whatever was in my mind, he already had it. And he had a few other suggestions to add. A few other programs are coming. Then I discussed with him if we could do this thing. And he gave me, just after a pause of a few seconds, he gave me 2 or 3 great ideas. And this was lovely talking to him, because I think if you are passionate about a subject and you go and you sit with somebody and you are talking on the same wavelength, and the other person is better than you, then you love talking to them and gaining from them. It's just like a game of squash. You always play with a player who's a touch better than you if you want to improve. But he's way and miles ahead, light years ahead of me. And I think now I've given up. The other thing, important thing about him is that he does everything with a smile and with politeness. And I think that is infectious. And I know we all have a day, and my day is 24 hours as well. Your day must be 240 hours. You can manage to do lots of things. We were talking about leadership. And the quality of a leader is that all his team is empowered, and they are allowed to use their initiative. They do work. And leadership is always at a horizontal level, whereas the responsibility is a pyramidal. So though the responsibility of everything lied on your shoulders, but at the same time, you were the leader as well. But all your team were leaders as well. And I think that is very important. And first day when I walked in, you were running around and putting the banners yourself. I didn't want to interrupt you. But I think hats off to you for doing this great thing and doing it for apps as well. And I think this will take apps a long way. So special thanks to you. And